Hi, I am Dr. Virendra Budnoor, consulting orthopedic surgeon with Apollo Spectra Hospitals, Kondapur, Hyderabad. I am specialized in joint replacement and arthroscopic procedures of the knee, hip and the shoulder. Frozen shoulder, adhesive capsulitis or periarthritis is a condition of the shoulder joint in which the capsule of the shoulder joint is largely inflamed. Shoulder is a ball and socket joint. If you look at the shoulder joint, it is made up of two important bones. This is called as the scapula. This is the humeral head. Shoulder is a ball and socket joint. It is similar to the hip joint, but the difference is the socket in the hip joint is a bigger socket, whereas in the shoulder joint, the socket is a smaller socket. This is because the range of motion of the shoulder is significantly high when compared to all other joints. So, the stability of the shoulder is largely from the muscles which are surrounding the shoulder joint. This is the capsule covering the shoulder joint. Since the socket is small, it is covered by a large capsule, and this capsule, because of any injury, can get inflamed. It is more common among elderly people where the capsule of the joint becomes stiff. Initially, because of pain, there is a restriction of motion. This restriction of motion will lead to a decreased movement in the shoulder joint. Largely, it starts with loss of rotations in the shoulder. There is a decreased movement in the abduction and forward flexion as well. This restriction will lead to a contraction in the capsule of the shoulder joint. This contracted structure, if you try to move, again it will lead to pain. So basically, the patient will be in a vicious cycle where pain will initiate a loss of motion will initiate a contraction of the capsule. This contracted capsule, which is tried to move, will again lead to pain. So to come out of this, initially the patient is evaluated with the basic X-rays and MRI scans. X-rays are largely normal. MRI will usually show a significant inflammation of the capsule and the subacromial space. The bursa in the subacromial space is called as the subacromial bursa. Even that is getting inflamed in this condition. How do we manage a frozen shoulder? The non-operative treatment of the shoulder will usually involve rest, non-steroidal anti-inflammatory drugs and physical therapy. Here the patient is asked to improve the passive range of the motion with the help of a physiotherapist. The physiotherapist will usually do slow capsular stretches, mobilize the scapulothoracic motion and then improve the strength of the shoulder. Subsequently, they will be put on theraband strengthening exercises to improve the strength in the muscles surrounding the shoulder. In case if there is no improvement with the conservative means of treatment, the patient can undergo injections into the joint, which are usually steroid injections or your cortisone injections, which are injected into the shoulder joint, which will reduce the inflammation, and again they will be followed up with the physical therapy. In case the non-operative treatment doesn't work, the patient has to opt for a surgical treatment wherein we do an arthroscopic procedure of the shoulder joint, where we release the capsule with the help of a radiofrequency ablator. The pancapsular release of the shoulder is done, and after that he is put on rehabilitation where the complete range of motion is attained. Thank you.